Knock, knock. Hello. Hi, my name is Kim. I'm a nursing student at Muskegon Community College. I also just washed my hands outside. I was hoping to ask you a few questions just to get to know what's going on with you a little bit more. Is that okay?
Yes.
Perfect. It's going to take maybe 15, 20 minutes. Do you have time for that?
Yes.
Excellent. Okay, is the lighting okay in here?
Yes.
Perfect. Anything that you need before we get started?
No.
Okay, all right. I am just going to go ahead and start off with your name. What's your first name?
Jennifer.
Okay, and last name?
Pyle.
All righty. What's your date of birth?
1/29/78.
Perfect. And how old are you?
I am 46.
Okay. How tall are you?
5'6".
5'6", 100 pounds, a BMI of perfect, excellent. So what brings you here today? Do you have any worries or concerns?
No, I just have some high blood pressure.
Okay, sure. Does that bother you or interfere with daily life at all?
Sometimes the high heart rate.
The
That's
high
the
heart
reason
rate.
I
Okay.
because I have a high heart rate.
Okay. All right. So are there any other health concerns that you have as far as sleep, diet, anxiety, or stress?
This class gives me anxiety, but no.
No, okay, sure. Okay, next we're gonna go ahead and move on to our immunizations. When was the last time that you got your flu shot?
Last month.
Perfect. How about pneumonia?
It's been probably 4 years.
Okay. And have you gotten a COVID booster recently?
Not in the last 6 months, but I think in the last year.
Okay, alrighty. So do you have any allergies to food or to medication?
No.
No, excellent. And are you taking any medicine on a regular basis right now?
Yes.
Sure. So what are you taking, including supplements, herbs, vitamins?
Okay, I'm a Toprol,
Sure. What milligram and how often?
150,
Sure
3
thing.
times a day.
Perfect.
So, and albuterol inhaler.
Sure thing. And that is as needed?
As needed.
Okay, sure thing. Okay, anything else you take? Vitamins, over the counter?
Iron supplements.
Iron, okay. So have you found any problems with medications? Anything you had to stop taking?
No.
No? Okay. And do you drink or use any recreational drugs? No? Okay, perfect. Surgery, have you had any surgery in the past?
Yes.
Including, oh sure, what have you had?
I've had my appendix and gallbladder out.
Oh my
And a
goodness.
hysterectomy.
Okay. And have you fallen recently?
No.
No? Okay. I'm sorry, do you mind giving me the date of that hysterectomy?
It was 2016.
Perfect. How have you been doing with recovery from that? Excellent. I'm glad to hear that. Okay. Do you have any family history of heart disease, diabetes?
Heart disease.
Heart disease, okay. How about blood pressure or stroke?
Blood pressure.
High blood pressure, excuse me. High blood
pressure.
pressure. Okay. No, no stroke though?
No.
Okay. How about respiratory disease?
No.
Okay. Or cancer?
My sister.
Your sister. Okay.
Thyroid.
I am so sorry to hear that. Okay. Do you have a history of breathing problems like asthma, lung
Sometimes
surgery,
asthma.
pneumonia? Yeah, we've got that in here.
Excuse me.
Do you ever suffer from shortness of breath?
Not very often.
No. Okay. How about a cough?
Occasionally.
Occasionally. Okay. So this is kind of a yes or no. We're going to go ahead and go with yes since we got a positive answer there. Do you have you had any chest palpitations, heart pain?
No.
I said that backwards. Chest pain or heart palpitations? No? Okay. You haven't had those either? How well do you tolerate exercise? How long can you do like a light exercise?
Light exercise, pretty good, an hour or so
Okay.
more.
Excellent. How often do you exercise, would you say?
Usually 2-3 times a week.
Excellent. Okay. And then any history of high blood pressure?
Yes.
Okay. Heart attack?
No.
Okay. Heart surgery or disease?
No.
Okay. All right. Have you had any recent weight gain or weight loss?
Weight loss.
Weight loss? Well, I apologize. I'm going to go ahead and comment there that I should not comment upon someone's weight positively or negatively. Okay. Are you happy with your current weight?
We're still working on it.
You're still working on it, okay. Would you say, how much water would you say that you drink a day?
Probably not enough, probably around 50 or more. I try to
50
get all 60,
ounces?
so yeah.
Okay. 50 to 60. Have you recently had any changes in appetite?
Starting to get less hungry.
Okay. And how often do you eat a day? Do you eat 3 square meals? Do you snack a lot?
Usually 3, yeah.
3, okay. And what is your diet primarily made up of?
I try to stick to fruits and vegetables
Okay.
and meats, proteins,
Sure.
stuff like that.
Okay. How about any carbohydrates?
Yeah, sometimes.
Sometimes, okay. Would you say you eat more meat, more fruits and veggies?
Probably more fruits and veggies.
More fruits and veggies, okay. And then we said that the carbs sometimes.
Yeah.
All right.
They're in there.
Excellent. Do you drink any milk, eat yogurt?
Milk.
Milk, okay. Very good, okay. Do you have any difficulty eating, like with chewing, swallowing?
No.
No, no pain, sensitivity?
No.
Any heartburn, GERD?
No.
No, okay. Have you had any vomiting or indigestion?
No.
When was your last bowel movement?
Yesterday.
Okay, sure. So about how often do you have a bowel movement?
Usually daily.
Daily, okay. And what color is that?
Usually brown.
Brown, okay. How about consistency?
Sometimes we're on the softer side.
Okay. Have you had any lower GI issues to complain about? No, I guess, a little gassy, okay. So recently, have you had any differences in your pattern of urination?
No.
No? Okay. How about incontinence?
No.
Okay. Do you have any burning, pain, or hesitancy when you do urinate?
No.
Okay. And do you have a history of UTIs or blood in your urine? Okay. And you do not have a prostate. Have you recently had any hair loss?
No.
Okay. How about dry or brittle nails?
No.
Okay. Do you have any patches of skin where there might be color differences, a change in texture?
No.
Anything sore or itchy?
No.
No? Okay. Do you use sunscreen?
Sometimes.
Sometimes, okay. And are you having any pain right now?
No.
No? Okay. So what would you say your sleep habits look like?
Getting less and less.
Okay.
My daughter's sick, so
Okay.
right now I don't
Okay.
get a lot of sleep.
Sure. What time do you generally try to go to sleep?
Usually around
10? And what time do you get up?
5 or 6.
5, okay. So I mean, that's right around, but not as much recently.
No.
Yeah. Awareness is half the battle. Okay. Do we have any difficulty falling asleep or staying asleep?
Falling asleep.
Falling asleep, okay. And I just have a few more questions for you. Do you have any limitations with mobility? Any soreness, stiffness when you're moving around?
No.
Okay. Is there any activity that you have trouble doing?
No.
Okay. Do you have a history of arthritis, backache, swelling?
No.
Muscle weakness?
No.
No? Okay. Do you wear contacts or glasses?
Contacts.
Contacts, sure thing. When did you have your last eye exam?
In February.
February, okay. Have you recently had any changes to your vision?
I'm starting to need bifocals.
Okay.
But
How about any hearing aids that you use or
No.
hearing loss?
No.
Okay. Any changes in your taste and smell?
No.
Okay. How about sensation? Any numbness in your fingers or toes? No. Okay. Any changes in memory, short term,
No.
long term?
No.
Okay.
Hope not.
Okay. And have you recently had any discharge, vaginal discharge, sores, STIs, any issues with menstruation?
No.
No, okay. When was your last self-breast exam?
Probably a month ago.
A month ago, okay. And And do you remember when your last pap smear was?
Probably 2 years ago.
2, okay. Are you currently on any forms of contraception?
No.
No, okay.
Hysterectomy.
That's right. We'll go ahead and skip the male section. So, do you currently have a support system? Wonderful. How about a significant other?
No.
No? Okay. Do you feel safe in your home right now?
Yes.
Okay. What would you say the most important goals are to you regarding your health?
Right now, just trying to lose weight and be healthy.
Sure. It sounds like you've accomplished some of those already. Yeah. Okay. How about with work, with your career? Are you pretty happy with that?
I just work part-time and
Sure.
stuff tutoring, so
Okay.
that satisfies and
Sure.
brings in some money.
Yeah, okay. Very good. Is there anything going on right now that's stressing you out or you're feeling fearful for
Just stress of school.
school? I definitely can understand that. Now, when you're feeling stressed out, what do you usually do to cope with that stress?
I try meditating.
Okay.
I try taking breaks and stuff.
Sure. Do you happen to have a history of depression, mood swings, or anxiety? Okay. What would you say is your greatest personal strength?
Helping.
Oh. It's probably why you're here today, huh? Alrighty, I have just a couple more questions and then we'll be all finished up, okay? Alright, I was wondering if your culture is impacting your health right now. Are there any particular beliefs that are specific to your culture?
No.
No? Okay. No alternative therapies, herbal medicine, anything like that?
No.
No, okay. What is your background?
White Caucasian.
Okay, sure. And regarding your health, what areas of your health do you feel like you have control over?
What I need to eat and stuff, and trying to help manage my stress.
Okay, sure. And do you have a support person that you like nearby when you're just not feeling your best?
Usually my mom.
Okay. And what's her name?
Jamie, Jayn.
Perfect, thank you. Is there anything else that is on your mind we didn't talk about?
No.
No, okay. Well, last few questions. What is the language that you speak?
English.
Okay, perfect. Okay. I'm not really seeing that. I'm seeing that you're leaning forward. Your posture is, very warm and friendly. I feel that we're a little bit closer than the 2 arms reach distance, and I feel like that's comfortable for both of us. I can tell that she speaks and understands English well. I did not necessarily notice a lot of nonverbal communication. Yeah, and I don't know the inches. I guess 2 feet is 24, so let's say 18. I would say 18 inches is probably comfortable. As far as a summary, excuse me, I apologize. I'm going to go ahead and finish this interview before I hop on to the next little bit. Thank you for being patient with me. I'm a new student. Okay, we are all set for today. I'm going to go ahead and make sure I get all this information taken care of. Is there anything else that I can do for you today?
No.
Okay, all right. I've got your call light right here. I'll go ahead and head out. Yeah, would you like the door open or shut?
Shut.
Shut, okay, all righty. Thank you so much. It was really nice to meet you.
Yeah.
Okay, as far as my summary, yeah, that was, it definitely felt awkward. I think that in like a patient setting, it would feel a lot more authentic, and I don't know that I would be so guarded on my questions because, I wanted to do it right, and that made me nervous. I forgot stuff, and then also, I definitely did struggle with my affect. Like I'm realizing that I'm a very reactive person. I want to have like a little comment or a little, inflection of my voice. But that is something that I definitely need to be aware of and work on because I do not want to influence any of these answers at all. So yeah, thank you for your time. I really appreciate it.